Oh,
Not very danceable.
I didn't pick this one.
We can make it work.
Alexa, stop. This is a family show. It was Baby Got Back. I don't know if anyone remembers that song from the.
Well, at least it wasn't WAP.
Oh.
Oh man.
We're live, y'all.
As someone of Italian heritage, I'm not a fan of that song.
Oh, I'm
right.
amazed you've even heard it.
I'm
That
plugged
says-
into the
that says
culture. I know
I've
what the young kids are all about these days.
There you go.
been
That's right.
eating, dreaming, and waking up to Monster Mash.
Oh, really?
Well, that's pretty innocent.
Because of Halloween? Well.
Yeah, my 2-year-old grandson, he's like every single 5 minutes he wants to listen to that.
Well, we're live.
Good morning, everyone. I'm gonna start wrapping up. Maybe
That's
it comes
right,
out
that's right.
naturally.
We'll have to play our own music. Hey, good morning, everyone. Welcome to Coffee and Dulce. I'm Christian Cano, one of your co-hosts. Today is November the 18th. Just a little over a week and 1 day from Thanksgiving. And we want to welcome everyone joining us on Facebook Live and also those who join us on YouTube and Facebook later. Once again, I'm having some musical issues this morning. And so
And you already paid Alexa, right?
Yes. Yeah. Well, no, I forgot. I keep saying I keep. All right. So I'm cheap. So
Should we start pitching for Kirsten? What is it? About $9, $5 a month?
yeah, $7 a month or something. I can't remember.
We need sponsors. Right. Can we do a GoFundMe for Christian?
Hey, okay, all right, I forgot where we're at. Oh, welcome. We want to welcome you to our show. Today's topic, we have switched today's topic and next week's topic. So today we're going to be talking about COVID-19 during the holiday season. We hopefully will talk about the guidance that's been given by Dr. Cohen and here in North Carolina, but also maybe around the country. We've got Dr. B with us. Now, next week's show, hopefully it's perfect for as we go into Thanksgiving. It is going to be how we're going to come together as neighbors after the election. So we'll have Republicans, Democrats, Libertarians, Independents, undecided.
Communist.
What about Greenpeace?
Yes.
Constitutional.
Yeah, Greenpeace. Well, as many people as we can get on just to talk about. If we can come together during the holidays, it's going to be just like a segment of CNN where we're all like, yelling at each other.
Oh, it won't be that bad.
No, I'm not joking. Now
It'll be our Giving Tuesday show.
Yeah, our Giving Tuesday. Oh,
let's be nice.
That's right. So let's go around the Brady Bunch screen. I hope Mamma Ruth, I don't know if you have that.
I have it.
Okay, let's go around the Brady Bunch screen.
Steven, Dr. B, and Joel.
Okay.
All right. Well, good morning, everyone. Everybody calls me Mamma Ruth, I guess. For some reason, I'm a mama. I'm a community advocate. I sit in different boards, and I'm co-host for Coffee and Pan Dulce, and I'm glad to be here this morning and kind of brighten up a little bit. And I'm so used to being the female between all gentlemen. Next.
She calls gentlemen.
I mean, I'll take it. I'm Steven DiFiore. I'm a member of the Libertarian Party of North Carolina, a known quantity, maybe not so well-known quantity in Charlotte, North Carolina. And I'm happy to be here, drinking my coffee, talking about fun stuff, hopefully finding a point of agreement and maybe a point of disagreement or two.
Joel, you go next.
All right. Well, hello, everyone. I'm Joel Odom. I am a Charlotte native. I am a city advocate for many things, one being just Black Lives Matter, housing, and all right now, all right. And if I was to have a button, it would be Medicare for all or I don't really know, Medicaid, Medicare. Hey, I'm not that seasoned, just healthcare. And that's it.
Great. I'm George Bohmfalk. I'm a retired physician. My primary advocacy is Medicare for all because that's what I understand the best and think will help an awful lot of people. My almost comparable level of enthusiasm and interest and commitment is in the Black Lives Matter racial equality, because I'm coming to learn the more I get into this that the fundamental issue in almost every issue we talk about is racism. It all seems to kind of boil down in this country to racism. So that's what I'm working on.
Well, thank you, everyone. I'm Christian Connor, one of your co-hosts, along with Mamma Ruth, and I am Medicare for All, of course. I can't get these stickers off this jacket, so eventually I'm going to have to take these stickers. But trust women, Biden, Harris, the election's over. Election's over. We're going to come together now, but it's still on my jacket.
It's over for some people, not everyone.
Yes. Oh, that's right. That's right. Moms Man Action, candidates. Baby Trump Pinata is with us. His cousin is still not broken. He's obviously a big Medicare for All supporter, wearing his mask and a Moms Man Action stickers and Constitution. And he has his little Star Wars friends with him for some reason. I don't know why, but we want to
Why
thank,
not?
That's right. We want to thank our Ponduce sponsor, Manolo's Bakery. I want to show you, they have these miniature conchas now. They're so, yes, I'm so excited. And this is a regular concha. This is a miniature concha. Also, this is
a conchita.
A con, yeah, I don't know what it was. Yeah, I guess that's a good.
Mamma Ruth, that'd be a conchita, right?
A conchita.
Yeah. Okay, that's my drag name, but I just thought I. Okay. Sorry, Steven, I had to throw that joke in there. I know you were thinking.
That's funny. I was thinking it. I want to be like, should I say it? And no, you beat me to it.
It's really jalapeno, but I just want to let you know that. Okay, so this is the time of year. This is the time of year that most families, if you follow this tradition, start ordering their holiday food. In our family, we order tamales around Thanksgiving, Christmas, and New Year's. Menudo's more New Year's, but people do them throughout this time period. Order your tamales now through Manolo's Bakery. You can put your order in. You have to put your order in advance. It takes about a day to get your tamales. We have our order. We have I think they have pork, chicken, and.
If you're vegetarian, they have vegan tamales as well.
Right. We also have a connection of someone who makes them at home, homemade. If you would like that information, Belize, her family makes them homemade, and they're just incredibly delicious as well. So I just want to say before, because Dr. B will, oh yes, let's salute, and then I'm going to tell you about the tamale. Everyone, let's salute to our neighbors for coffee and Ponduce. If you have your coffee with you. That looks fancy, Joel.
That's what I'm going to say. Joel, you're always showing off.
That's a milkshake. What is that?
Starbucks.
Oh wait. I also get my Waffle House coffee.
Ooh.
Oh man. Listen, I say what you want about Joel. All good things, I hope. The guy has great you have great taste in coffee
yes.
establishments. I love your sweaters. Just an inspiration.
Thank you.
That's the one thing I miss about going out to eat is Waffle House. I'll tell you, I really.
Now that's only from 1 to 5 in the morning, right? That's the only time anybody goes to Waffle House, isn't it?
No, I go during the day. It's never. Okay, so the tamale.
Did you know that there's a Libertarian Waffle House caucus?
Really?
Yeah.
Wow.
Yeah, it's because a bunch of us really like Waffle House, and almost every city that we have conventions in, we just go and like meet up at a Waffle House beforehand, get some get some waffles, get some grits, eggs, whatever, and then drink a bunch of coffee.
All about individual freedom, no concern at all for your health.
Oh, this is pre-COVID, right?
Well, yeah, I mean,
I mean Waffle House in general.
Oh no! Listen, Waffle House is fantastic.
Nobody was at the Waffle House when I went this morning. I just got coffee. So.
Oh, okay. Well, so the tamale. If you are not familiar, you do not eat the husk.
I got a story about that.
Yes, I knew everyone does. I still have to remind people when I refer them to tamales, the husk comes off. And you eat what's inside the husk. You do not eat the husk. So
now, some people only eat what's inside the dough. The dough.
I always think it's funny when I refer people to like tamales, and they're like, "Where can I get some tamales?" And I'll give them, and I just have to. I see their don't eat the husk. that comes off. Okay, so
So the
Everyone-
first time I ever saw a tamal, one of my coworkers, she's like, "Hey, try this." I'm like, "Okay." So I'm looking at going, "This looks really chewy."
I told you.
And then she starts cracking up. She's like, "What are you doing?" I'm like, "I'm trying to eat this thing." She goes, "Don't eat the husk." I'm like,
Yes.
"Oh."
How do you eat shrimp, right?
That's
I
right.
mean, wait. No, I eat shrimp like a good Italian. Ate the whole thing, tail and all.
Ooh, that's terrible.
Crunchy.
Well, I'd hate to see you in the South. We have what we call crawfish fries or crawdads.
Oh, I love those.
Yeah, and you're supposed to. I can't do that. It's like. So
Suck the
anyway.
head? Heck yeah.
Okay, so we've gone a different direction. So we want to talk about.
Totally. You went totally left.
Before we
Yeah.
move forward, let's say hi
Sorry.
to Lynn Marie. Slika is watching us.
Yeah.
Lynn, thank you for being here and thanks for your comments.
All right, so let's talk about how we're going to be safe during the Thanksgiving and Christmas during COVID-19. We are in the we are in the darkest days of the virus. I guess that's fair to kind of express it like that. In other words,
Virus or this pandemic?
yes. And so where it's getting colder, people are going to be inside more.
So just literally darkest, not metaphorical.
Yes.
Oh.
Yes, that's correct. And so there's some guidance that has come out here in North Carolina, and I'm sure every state, hopefully, I mean, I know some states probably don't. I mean, one of the Dakotas just finally required to wear masks. The governor has made a reversal after they have seen, I think they are the highest percentages in the world in the Dakotas, and they finally required. So here in North Carolina, the governor has issued some warnings, some colors about counties. Red, yellow, I think, and green. There's orange. That's right. And so it will help people determine which counties are having higher outbreaks and so forth. And so
Mecklenburg came out to be yellow.
Yeah. Oh, did it?
It was not that high.
Oh, wow. Huh.
I think Greensboro was red.
So yes, and so they issued this travel guidance, I think last week, or maybe it was a week before, about suggestions on how to deal with Thanksgiving and then also Black Friday. If you decide, I think Dr. B will, I don't want to put words in his mouth because we want to hear what he has to say, but I am assuming his first thing is the safest thing is just not to travel. Is that fair to say? I would say that's so.
Discussion over.
Yes, because that's exactly what my doctor told me when I told her.
I agree with that.
Yeah. And so the guidance you can find on our Facebook page, or you can also find on the Mecklenburg County page or the North Carolina page. And it tells you, please try to get tested 3 days before you travel, or self-quarantine. And there's all kinds of stuff. If you're going to meet with your family, be outside, do wear the mask, obviously. And just because
be tested 3 days prior if you're traveling. A lot of our folks are not understanding that travel from here to Raleigh, that's a travel for me. Mm-hmm. And they think just by going to the beach and coming back, they don't need to get tested or anything. And then they come back infected. And now, since they don't have no symptoms, we have to deal with it, us that are exposed to those kind of people. How are we going to make them understand that you have to try, if you're going to go out of your house, go get tested?
Well, one of the ways I think we are is hearing from Dr. B, because we all do exactly what our doctor says. So when the doctor asks, do you work out every day on the treadmill? Yes, I do.
It's like that time I went to my physician and did a blood test and my cholesterol level came back and they said, we have to have a conversation about your cholesterol level. It's way too low.
What?
Yeah. So like you need to start eating more things that have cholesterol in it. I was like,
oh man.
Well, gosh, I'll do my best.
Yeah, that's bizarre. Okay, so Dr. B, what is your recommendation on, I have a feeling not travel, but for those who plan to stay here or those who plan to travel, what is your recommendation about, or what do you want to add?
Well, what I'm going to add is not going to make much difference to anybody because it seems that the world is divided between people who are really worried about this, like me, and people who kind of say, oh, well, you know, it's more important to be with family. And if I get it, it's probably going to be a mild case and all that. Well, let me tell you, think of it like poison. In a lot of respects, you can get, you know, a tiny bit of poison and it won't kind of hurt you. But if you kind of have to get a little bit more, well, you're dead. And if you get tested for poison today and there's none in your system, that doesn't mean that you're good for the next week or so. You might get poisoned tomorrow and not even kind of know it. So, you know, how important is it that you get together with your family? There are bigger things in life, like maybe the ability to get together with them at Christmas if you're not dead because you got together with them at Thanksgiving. So I know things are different importance to different people. I have some very intelligent, cautious physician friends who think they're okay, so they're going to go visit their family and grandkids, and I really worry about them. I mean, statistically, the odds are they're going to be okay, but it's like Russian roulette with a whole bunch of chambers in the gun and only one bullet, and if you get it, you know, you may be dead. So for me, this is just a time that I'm afraid that because of lack of leadership from the top, the country has allowed itself to get lazy and careless about this. If we had done the right thing from the start and really done a serious shutdown in all states and everybody wore a mask and kept their distance, we'd be through this. And so right now we're just continuing this dribble. I read somewhere the other day that because of poor leadership and I think lazy attitudes on a lot of people's parts in terms of masks and getting together people and everything else, we're going to move into the era of this not being a pandemic, but it's going to become, and it's not an epidemic. Epidemic means something that hits and then goes away. It's going to be an endemic. And what that means is kind of like sexually transmitted diseases. It's just going to kind of be with us forever.
Or influenza. Influenza's endemic.
Yeah, all those kind of things. That there's going to be kind of this low-level smoldering along, whereas we did have the opportunity to really kind of get rid of this, like essentially smallpox, polio, some of these things. So, you know, I don't know that any advice I give is going to fall on any open ears because people have probably already decided by now what they're going to do for Thanksgiving. So let me say, if you are going to travel, if you do have to get together with your family, I'm not sure testing makes any difference other than the fact that if you tested positive, maybe you'll change your plans and stay home. But if you are going, please, please, please wear the mask, except when you're, you know, eating. At the table, try to separate yourselves rather than 12 people being crowded elbow to elbow. Maybe have 2 tables, put half the group in the kitchen, half the group ideally, or all the group outside if the weather's permits. That's the safest, spaced outside, but otherwise space yourself indoors. You don't have to be all together. I've heard these things about, oh, take your own utensils and things like that. You know, I'm not sure that's the point. The concern is transmission from aerosol droplets, you know, in your coughing and talking and breathing and everything, rather than this from getting it from a fork or a spoon.
Excuse me, Dr. B. You know, something that I realized when I was just at an event. I've gone to a couple events now. I was with Steven, right? Something I picked up on.
I saw those pictures.
Yeah. People take their masks off to talk. And the most important time to wear it is when you're speaking.
Exactly.
That is so frustrating to me because legit, that really, it bothers me, but it doesn't. You know, it's just like I want to go over and be like, you need to put your mask back on.
You know what's interesting about that, right? So, like, I'm sitting right next to Joel, and Joel's talking to me, and you know, not many people know this, but I had my ears damaged due to an infection, right? So when I'm talking to people, I usually rely, like when I have these headsets on, these are great, but when I'm in person, I'm talking to people, I'm kind of relying on getting input from my ears, but also watching your mouth move to figure out what you're saying, right? When people are wearing masks, not only can I not read their mouth, but the sound coming from them is very muffled. So like for me, I go about my daily business when people wear masks on, essentially guessing what people are saying to me. And I don't always like get it. Like, so for example, Joel, when you're talking to me, man, I could hardly understand anything you said. So I was just trying to be like, oh man, I hope I don't seem rude. like partially deaf, and I can't hear what he's saying.
But it's all right. It's all right. But
So it's tough, for some of us to even communicate with people. I mean, I'm not saying that's an argument against masks, but it is a difficulty that some of us have to deal with. That's a little annoying, but it is what it is.
No question. I mean, aren't we all dealing with difficulties that are annoying? I mean, we would all love to go to restaurants and bars and hug our grandkids and things like this, but the option is you might die. And to me, that just kind of cuts through it. And I think people just don't accept that. And, we hear story after story on the news about these people taking their last breaths in the ICU, and they say, I thought this was a hoax until now. Well, do you want to be that guy? It's not a hoax.
oh, it is
They're wearing the
something.
mask thing. Say what?
I said it's something to see because if you're going to a liquor store in Charlotte, you have to wear a mask,
Yes.
to go to any ABC store. But if you go to like Frugal McDougal in South Carolina or anything, they don't require you to wear masks or anything. I have a face shield, glove, and I mean it's really something
The
because
guy walks around with a hazmat suit. It's pretty legit.
it's like a lot of people really don't take it seriously, especially African Americans. I see a lot of African Americans in South Carolina not wearing no mask now, not wearing no face shield, no gloves, no hand sanitizer, no nothing. And it's just basically like
What I have read, and
Well, some of the restaurants already also removed their enforcement of wearing masks as well. I noticed that at Chili's. I've noticed that at I can't remember right now the crab. It's like a Mr. King crab or whatever restaurant. I noticed that as well. Some of them are not enforcing them at the beginning.
well, one of the things that I read, and Dr. B, maybe you can comment if you're aware of this, is that the spread is no longer only about large gatherings or like parties or things like that. That the spread is actually being spread more amongst small groups of individuals who are like a family comes over to have a glass of wine, or a couple of friends go out to dinner at an open air restaurant, and that they are finding that those are where the spread is growing the fastest because people just feel more comfortable around like a smaller group. And that's what they said, that it is actually spreading amongst that group faster right now. I don't know if you know anything about that, or, and the reason I say that is because I have been watching what's going on in Texas, specifically because a lot of my family lives in Texas, and there's a lot of reports of individuals, family members that are inadvertently giving it to other family members, and they were just like going out for a small, dinner or whatever the case may be. And that's a big concern, about how people are spreading it. Another thing I want to ask if anyone feels, do you feel any different, and especially Steven, Libertarian, because you're the face of you're not the boss of me, people right now at this moment. So just for this show, for argument's sake.
I will bear that cross for you,
Yes,
Christian.
okay. So do you feel any different between where we are now than where we were, let's say, in June or July? Do you think more people are just coming to the acceptance of we just got to wear a mask? Even though, like Joel said, some people are still not wearing them in South Carolina. Do y'all feel any difference in what the conversations people are having? I'm just curious because I haven't really heard a lot of resistance as much as we did obviously before the election, because it was more about politicalness, I think. I mean, are you still feeling? Yeah.
I mean, heavens, on the floor of, I guess it was the Senate, I think yesterday or the day before, this Republican who was, filling in for Pence and chairing the Senate was sitting there without a mask on. And he was kind of saying, oh, you don't make fun of me for not wearing a mask, like, please. So, no, there's still a lot of resistance and a lot of idiocy about it, and a lot of partisan kind of stuff. I'm not sure it's racial. Joel said something, I've seen a lot of, blacks that weren't married. I see a lot of blacks that do wear them, and obviously, I think the word is out that a disproportionate percentage of the black and other colored communities, Hispanics, all these indigenous population, are suffering from COVID than the white community. So I think there's a growing awareness in minority in people of color that they're at greater risk, and so I would think that they're doing a little bit better job. But no, on the one hand, it seems like there's three groups. There's some folks that are kind of saying, yes, it is just common sense, and let's all kind of wear masks. And then there are the people with their hands on their hips. But then I think the third thing, Christian, you alluded to, is I think people are just getting tired and bored, and nobody they know has died yet. So they're kind of figuring, oh, well, then maybe it's not as bad as everybody says. So I'm going to get lazier and I'm going to get together in the backyard with friends. And yeah, so more of that is happening. And as a result, more spread is coming from these small group contacts, because, you can run, but you can't hide. And I even worry about going to the grocery store once a week. So, you just can't be too lazy with this. Not everybody that fought in World War II got killed, but a lot did. And, so the risk is there.
Here's another point of view that probably a lot of people have, but doesn't get expressed very much because there's a lot of, I guess, societal or political pressure not to say this. So I've been doing a lot of reading on COVID out of curiosity. Because I've asked a few questions in the past and people don't know. So I'm like, well, let me go see if I can find the answer. So, earlier, Dr. B, you compared COVID to smallpox, stuff like that. Well, there's a big difference between something like smallpox and something like a coronavirus or COVID. This particular one, SARS-CoV-2, is that smallpox was a DNA virus, meaning it doesn't change, right? And COVID is a coronavirus, which are what are called retroviruses or RNA viruses, which means they do change. And in every single instance in history that is known, that I've read about, every time what's called a zootopic, that means from an animal, that's RNA virus, make jump animals to humans, and with the exception of filoviruses, which are a different kind, right? Those are the things that cause Ebola and crap like that. But every time that you have a virus that makes that jump, it's in the human population. There you go, a new disease now. So the thing is, as much as people don't like to admit it, as much as people want to say human beings are so amazing, we have so much control, we probably have a lot less control than we think. COVID has made its way into the human population. It's spread across the world. This is not necessarily my opinion, but it's an opinion of a lot of people of some people that I know about. Yep. COVID is not a pandemic anymore. It's just an endemic disease that we're just going to have to get used to. And, that's a really uncomfortable thought for a lot of folks, because we've become so, lazy to the effects of health and health outcomes, right? The idea that you have a virus. So, and I'm going to throw out a percentage here, but this is something to think about. There was a time when 30% mortality from disease was just a fact of life, right? That
like childbirth.
What?
Like childbirth.
Yeah. Well, no, I'm not talking about childbirth. I'm talking about disease now.
It's
right?
About the same. Yeah.
Yeah, so there was in some places it's still that, right? But in any event, there was a time where that was just a fact of life, and people all knew this and they grew up with it and they were used to the danger, so it didn't seem afraid. But then, an amazing thing happened. Competent medicine was invented and spread throughout the world. And now, if you have something right now, like COVID, that has a 2% mortality rate, that's considered a terrifying plague, because from everything that we know about, it kind of is, right? And it can be, if you don't put things in perspective, which is hard for a lot of people, it can be really hard to get your head around that. But in North Carolina, we have had, a little less than 5,000 deaths due to COVID. And that's really sad, right? That's super sad for so many people, and for the folks who lost loved ones, and that's a shame. Yeah. But what's interesting, if you track from what the government gives us, you track those death numbers and the hospitalization rates, that seems to have leveled off, right? Which is good, because it means it's, as far as we can tell, under control. So that's a bit of good news. That curve has been flattened. Now, because that curve has been flattened, that's great. But now, people are talking about cases now, but it is what it is. What's a case again? But there are other diseases that we don't talk enough about that are even more dangerous. So like cancer, 20,000 people a year in North Carolina, heart disease, 18,000 people a year, chronic lower respiratory disease, usually caused by smoking, over 5,000, right? And these things, the people who tend to die of this disease tend to have comorbidities like cancer, like heart disease, high blood pressure, they're overweight, whatever it is, and so taking more control of your health is a way to feel more, I think, a way to feel more empowered, to know that even if you get sick, because here's the thing, I know a lot of people who've gotten COVID, they were sick for a week and then they got better, myself included, right? That is not to say that it's not dangerous, because of course 5,000 people have died from it, but this is not the bubonic plague. And I think a lot of people just are so unaccustomed to the idea that you can even die of an illness because of competent medicine, that for a little while, until we get used to this, until more competent treatments come out, until the vaccine is sort of like in the medical space to be given along with a flu shot, it's going to put a lot of people on edge, and that's a real shame. But trying to put it into perspective might be really good, at least for people's mental health.
No, I think I understand what you're saying, Stephen. Not put words in your mouth, but basically what you're explaining is we have to understand, because sometimes we're like, I don't understand how you're not the boss of me people can't take this seriously, or why aren't these people not wearing a mask? And if we try to see it from their point of view, what you're saying is there is a certain percentage of our population that, regardless if it was COVID, it would be that same way anyway, that are saying it is what it is, it's in our system, let's just deal with it. And then there's the percentage of the population, which I guess I'm in, that wants to do everything I can to minimize the loss of life to individuals. And there's those two, so
it's not necessarily a binary choice.
I can give you a perspective from just in Charlotte, Mecklenburg County.
Sure.
Okay, there has been a kind of lack attitude towards it, especially in the African American. I'm not even going to say especially in African American community, just in communities of color that is very religious or just spiritual. And you have cases where people are saying, well, why can't we go back to church, but the strip club is open? Why can't we go back to church? The liquor store is open, and people want answers. But then you have instances like the House of Prayer, United House of Prayer for All People, came together, had holy convocation. Thousands of people came. We don't even know how many African Americans still don't have COVID. If they have it, if they don't. There was, I think they counted over 200 people got COVID. I think 6 or 7 people died. And then the House of Prayer also, they wanted to do, I think, another event. So there is a lack attitude, especially in communities. You just, like, every community is different. Everybody's different. Everyone's not the same. Like, I'm pulling up on the COVID-19 ncdhhs.gov. African Americans, 31%. But, which is surprising to me, Caucasians, they're at 46%. So that's just a surprise to me. But it also tells me, we can do better than what we are doing.
Yeah.
What about people with TB, and also some of the people that we don't even know that they're carrying around hepatitis?
Yeah.
What happens with that?
Wait,
So,
TB, tuberculosis?
Yeah.
It's not very common, is it?
Well, but I think we're making some false equivalences here. I mean, obviously, Stephen mentioned these other diseases that probably kill more people every year and have some personal responsibility tied up to them, like COVID doesn't. So, yeah, there are those things. Granted, right now, they do not risk overwhelming hospital facilities. No ICUs are filling up with people with lung cancer, TB, chronic obstructive pulmonary disease, or hepatitis. They're not. The hospital, they just kind of dribble in because they're endemic. They're low level. We kind of have a handle on handling them. COVID patients are overwhelming ICUs. Several institutions are now
in North
rationing.
Carolina.
Just a minute. several institutions are now rationing care across the country because they don't have room for them. I don't know about North Carolina. I'm not looking just at North Carolina. I'm looking at the whole country and the whole world. So COVID is a different thing. It's not the bubonic plague, certainly, but it's threatening, overwhelming the healthcare facilities. And I think everyone could be a little bit more responsible in trying to keep that from happening.
I think that right there does play a point, because I've been in, this is why I do wear gloves and stuff. I kid you not. When I did go, I personally, my family's been a part of the House of Prayer for over, I think, 100 years or whatever. So we go. But when I went, I had to leave. I had to leave immediately because I saw it with my own eyes. I mean, kid you not, people have masks, but it's on the chin. That is some scary stuff. And then, like, all the diseases you were just, I'm not diseases, but all the healthcare issues you were just talking about high blood pressure, diabetes, and everything else. Kid you not. Those were the people, the high risk people. They were the ones there. They were the ones wearing no masks. And I mean, you know, they got diabetes because their ankles swole or the arm, the wrist is swole. You just can see that people aren't doing what they should do to lower the risk so that everyone can start going back and enjoying themselves. Because that's something I do.
Well, Joel, that's the reason I asked the question kind of the way I did, is because I understand what Steven is saying. But I think the thing that is different about this, that we, woulda, coulda, shoulda, I think we would be in a completely different space in time had we had leadership from the top that took it seriously. And because
I agree with you. I remember back in March when Chuck Schumer and Nancy Pelosi were saying, COVID's not a deal. Go out to Chinatown, hug a Chinese person. I remember that. That was bad leadership.
But if that is your only argument, if that is your only argument, that's a very juvenile argument. To say, well, you told me back 2 years ago that I couldn't stick my finger in a thing, and then that's an argument that children give. We're adults. We've learned from there. So if you're not the boss of me people are still using that childish juvenile argument, then I'm glad that they're not in leadership positions, because the vast majority of our community, our neighbors, want people more adult and responsible in leadership. That's why we're voting them in. And so even though I understand the libertarian kind of point of view, and I understand I don't like being in this situation, we want the vast majority. There are people who still want, I don't want to wear a mask, you're not the boss of me. I understand that, and I get that. But the vast majority of families, because some of us, for whatever reason, we want people in leadership positions that don't think that way, or else we would vote them in. And so and that's, to me, that is the unfortunate part of this, is those arguments that were used back in June and July, like what you just said, are like something that children say when instead of just admitting.
And it gets amplified in the news space, and people internalize that, right? So there's a reason why I brought that up. And I admit, I agree with you that it is a juvenile argument. And this was back in March when people didn't know nearly as much as they knew now. But the reason why that argument was being made by leadership in the Congress, right, was because it was in direct opposition to directives that were coming out from the executive branch. And so 2 months later, both sides switched tact. And it's as though no one even remembers that happened, right? Again, this isn't something that happened 10 years ago. This literally happened earlier this year. And because most people don't really pay attention, right? And most people don't have their own opinions. They're assigned their opinions by whatever media they consume on a regular basis. We forget that, at one point you had, back in March, the executive says, ooh, this is probably bad. Let's shut stuff down. The legislature was like, oh, you're a terrible person. Don't do that. And then a couple months later, it's like, oh, wait, it's starting to affect our economy, the bottom line. And then both, or whatever reason it is that they decided to switch tact, they just switch sides. It's like, the protesters walk across the street and grab the other guy's sign. like nothing ever happened. And a lot of people are seeing this and they
Well,
say, this is all political. This is stupid. Why should I listen? And it
Well,
does people in this country a disservice when
yeah.
leadership, whether it's at the federal level or even the state level, appear to be making their decisions
right.
less off of healthcare concerns or concerns for communities and more on political concerns about what is most expedient for them to keep them in power. And it's a real shame.
Yeah, no, so Joel, you want to say something?
Yes, I do. I would like to say something. I think our biggest mistake as a country was instead of listening to our political leaders. Kid you not, I've one day I might want to be governor or whatever. But when you have something such as this, our biggest mistake was in not listening to the medical professionals in that area. Instead, we allow ourselves to listen to leaders that has they might have doctorates, but they're not a medical doctor. Okay, that's something that we failed on. Because that's all I have to say with that part.
And that's, I guess that's kind of what I'm saying. What I'm hoping is, and I'm really am hoping this. I'm hoping that as we get closer to this person leaving the White House, and as we get closer to a more rational, reasonable adult being in the White House, who will default to the experts for advice and for those, I'm hoping that we will that the messaging will just be different. And so what I'm feeling is, and I gave this example before with Mamma Ruth when I called my dad about Thanksgiving, and my dad is now wearing the mask everywhere he goes. I mean, everywhere. And my dad's had 2 bypass surgeries, but it took a while for him to get there because the people who he was listening to was, it's not really, it's not really that serious. And, there's no reason that we should, those same arguments that you were talking about, Stephen, more people die of this and this, so forth. And he was absorbing that information. So what I'm hoping is with a new direction, because the efforts to work with this, obviously I think everyone can agree, whether you are the boss me person or you're a let's lock down kind of person, whatever extremes, we all can agree it failed. Trump failed in his ability to handle this issue. And once that has failed, we need a new type of effort. And I'm hoping that the new type of effort will, just the basic things like wearing a mask, basic things. I
do have a question though. The response was mostly, and in my opinion, as it should have been, delegated down to the state level. Different states made the decision to do what they wanted to do or not. So I live in North Carolina. I look at what the North Carolina state government did. Do you think the North Carolina state government failed?
I think that I think just for me, I mean, it's sad that for those of us who remember how this thing worked back in March and so forth, the president is a very reactive individual. He's not a proactive individual. It's almost as he always talks in third person. He acts like he's not the president. He says something, waits to see what's happening, and then he reacts to it as if though he's not the reason that it's acting that way.
That's a known quantity. He's been like that for his entire term, right? Yeah.
No, exactly. No, I know. And so that is the worst kind of person you want in a crisis. Anyone who runs a company or runs an organization, that's not the type of person that you want in a crisis. And unfortunately, that's the type of person we had in a crisis, which is why we all take Myers-Briggs tests before we take a leadership position in the corporate world. They want to know how we're going to react in an emergency, whether we go this way, this way, this way. And then they put those people in positions in crisis management and whatever the case. And so he was the type of individual that when a crisis happened, he was not going to react stable. He was the one who's going to be, fire, running crazy. And so unfortunately, that's what we had. And as a result of that, the states had to bypass him because they had no choice. And it would have been, woulda, coulda, shoulda. But I think with a normal person up there, I hate to say it like that, but a normal person up there, it would have been a partnership. We're going to do the best we can in this. And what do you need, states? What do you need this? Let's give guidance. The messaging, everyone this is going to be tough. If we all wear masks, maybe we can minimize the
Oh my
amount.
God. There's
Yeah.
the first thing, you know, we
Yeah.
can't say or not whether it's true or not, but there was supposedly the UPS, the mailmen were supposedly going to mail out free masks to everyone. I think over 100 and I think about 115 million masks. We were supposed to all get free reusable cloth masks. Now they say that because of Donald, we didn't get these masks. But that would have been something. See, that's one example of just poor leadership. Because first, if he would have said, well, the postal workers are sending out free masks, please wear a mask, that would have been a great example of leadership. Whatever. First fortnight. But let's just go on to the conversation about Thanksgiving.
Yes. Sorry.
Well, but I feel compelled. Stephen, I know you're very much a federalist, states' rights kind of, everything should be done at the local level. But, how can you have a good policy for a state like North Carolina? And for example, let's say you have a terrible policy for a state like South Carolina, and the interchange between Charlotte and people in Rock Hill and whatnot is constant. It is a total open border between our states these days. So I think it's illogical to kind of say, let's leave it to the states and have everybody wearing a mask in one state and not in the next and going freely back and forth.
Yeah, that's
it's just like with it's just like with gun control. Everybody talks about, oh, the states ought to make their own rules. Well, that's why you have states with really strict gun laws, like I believe Illinois and New York, with some of the highest gun rate deaths, because people just drive them in their pickup, loads of guns from a lower regulation state to a higher regulation state. And the regulations are meaningless because it's so seamless to have this interchange and the commerce between, among all the states. So similarly, I think it was ridiculous for Trump to just defer all these decisions to the states, because we had each state competing against the other for PPE and ventilators. And all. It was a fiasco. And so if there was ever a time for a unified national coordinated response, it was this, and we didn't do it. And now we're clearly paying the price.
You all have far more faith in the feds than I do.
Yes.
I don't think they're
sometimes.
I don't think they're
Sometimes,
even
yes.
capable of having a good response, which is why devolution of power is so important.
Well,
I mean,
and-
don't forget that it was the FDA who stood in the way of getting test kits to the people of North Carolina, right? To be specific, right?
Yeah.
So there are a couple different companies, including one company in North Carolina, who were making COVID test kits early on in the pandemic that the FDA would not approve. So those companies had to sell those test kits abroad, because other countries like, yeah, sure, we'll buy those. It was our own government that said, nope, we're not going to allow you. This was the feds who said, you do not have the ability to buy test kits.
So hopefully under a new presidency, we won't repeat those mistakes. And so, that's, I'm hoping.
But is it going to be under a new Congress? No. And here's the thing, like we're talking about the masks for UPS. Which branch of government appropriates funds for things like that? It's the Congress. The Congress didn't do anything, and we have the same Congress that we had.
No, I understand what you're saying, Stephen, and I hear your frustrations, but those conversations, I think, are debates that we should have after we get this under control. You can't try to get something in control, and while you're doing it, complain about the system. And so the good news is there's more people who want to get it under control first, and then we can debate whether those things happened after we get this under control. And so I do hope that under a new presidency and under new leadership, we can get it under control, and then we can look back and say, and have the conversations that we're having, so we don't repeat that same mistake again. And so, so with Thanksgiving, which is what this was supposed to be.
I can't wait to eat some turkey. I want some turkey and some canned cranberries.
So with Thanksgiving and holidays, I would be more comfortable traveling to Florida or Texas or one of the Dakotas if we had a more national policy, because I would be comfortable knowing that what we're doing in North Carolina is the same in those states. but because I know it's not, it makes me very uncomfortable to travel outside of North Carolina, because I think we're doing, of the states, one of the better jobs of trying to keep it under control with all the complaints, with all the, what the obstacles we have in Florida and Texas. They're paying catch up. And so I'm all about, being preventive rather than being reactive. And Mamma Ruth, we had this conversation because we don't have about 10 more minutes left, but we were talking about this. And one of the things in our Latinx community is there's this stigma with having COVID-19, which is one of the reasons why some people, A, don't tell their family members that they have it, and B, unknowingly share it with other people. And so we've got to get rid of that. And Mamma Ruth, we were talking, like when someone has a cold and someone has a flu, it's very common with many of our families for the person who has it to say, I'm sorry, mijo, I think I'm coming down with a cold. I need to stay away from you guys. It hasn't been at that level yet with COVID, with people who are asymptomatic, that they're going around other people. And so, Mamma Ruth, didn't you say something?
It is. I mean, it's very controversial because, yes, a lot of our Latinos, as Latina, I've noticed that a lot of my neighbors will not accept it. They understand it. They start taking care of themselves at home and stuff, and they talk about the COVID. They talk about the measures and procedures and everything. But once they get infected on their own, like their family or whatever, they will not talk about it. They will hide it. They will make it seem like, oh, this is the worst thing. People are going to look at us badly. They're not going to want to get near us. It's completely the opposite. Instead of bringing awareness to our neighbors and say, hey, you know what? I took it for granted, and it got me, and I'm trying to help others. So me and my friends started, we're going to start next week, especially for our Thanksgiving week, making short videos with our mask and promoting and bringing awareness for our Latino community, because they're not taking care of themselves and think, okay, I got invited to my second cousins for dinner. Yeah. They don't care if you have symptoms or not. They don't want to reject that invitation. They don't want to say, hey, you know what? I'm having symptoms. I might not just make it, maybe another time. No, they want to be there, part of that, the party. And they don't care what's going to happen with their neighbors, with their family member, with their elders, with high-risk people. Something that I want to read to y'all with what Lynn posted earlier. It has to do a lot with our Latinos and our low income. It says the sad reality is that many people do not have access to healthcare, which is true. So I guess some of those people don't want to mention that they feel sick or anything, because they don't, the first thing we're going to do is go to the doctor, go get checked, go get a test.
And, I know I tell people, I say.
But you know what? Their ignorance thoughts are, if I go get tested, they're going to charge me. They don't really understand that some of the testings are free.
Yeah.
This is open to the public, no matter if you have documentations or insurance or not. This is for your own safety.
It reminds me of, I have a very difficult time because I've always tried to keep myself as updated on what's going on. And not everyone is like us. Not everyone has the ability to sit around and discuss these things. And Steven's a very philosophical person, does a lot of reading and things like that. Not everyone's like us. Most people are not like us.
Yeah, most people are not nerds.
Yes, well, that's good. And most people, their everyday life is getting to work, getting gas, doing those things. Working class people, not that we're not all working class, but most people are like that. So every time I say, how did this person win, or who would vote for Trump, or who would vote? Because we have to remind ourselves, we're not most people. They're doing those. So when, and I like to use my dad as an example. My dad will not go to the doctor, used to, because he figured if they didn't tell him that he needed heart surgery, he didn't need it. And his dad had brain cancer, and for several months, was having the sinus issue and this, and he didn't want to go because he knew once they told him he'd have to face the realization. So there's a certain part of our population, for whatever reason, they fear going to see a healthcare professional because once they see it's reality, it is. And so it's almost like, well, if I don't know about it, then I don't have it. You know,
Well, my mother
Yes.
just sent me right now to the store to go get her some coughing medicine. And I looked at her and I said, you've been coughing? I said, they just checked your lungs and they were clear. So you must have allergies or something. She says, yeah, just go get me something for my throat because I feel a lot of mucus. And I said, no, I'm going to call your doctor and see what he wants to prescribe you or if he wants to see you inside or not. Because they auto-medicate themselves. They go to the grocery store and buy something that is not even for it. And that's their mentality because they don't want to face reality. They don't want to face the real thing.
And so and the reason I say that, everyone, I'm just looking at Stephen because you're right there on the screen with me a lot more. And the reality is, for most individuals, and even us sometimes, leadership matters. What my doctor says weighs very, very heavily on me. For some people who may not have a primary care physician like I do, I'm fortunate to have one. Political figures or their parents or someone who's an influencer in their life says. So when the president of the United States, because we've never had one who was lied this much, when the president of the United States says, I'm Superman, it's no big deal, I got over this, there are people who, not because they're whatever reason, believe it's not that serious because the president, I mean, that's really how they think. And they may be too embarrassed to tell you that because they may think you're going to laugh at them or whatever. But there's a lot of people, when the mayor of our city doesn't say it, for whoever they look up to, you know, and so everyone has influencers. And I think every day, who the heck would watch the Kardashian show? I mean, why would you? But people do. People watch, you know, the Kardashian.
I mean, a lot of people get an endorphin hit when they see Kim Kardashian.
Well, that's
I don't understand it, but you know, it is what it is.
And so because
people like those endorphins.
Yeah, because there is a lot of most people who aren't like us, we have to remember that everyone's influenced for whatever reason. And then to Joel's point, there are a lot of people of faith who look up to their pastors, their spiritual leaders. So if their spiritual leader is saying, we're going to have a gathering, we're going to have a retreat, they're caught between, do I follow this person because that's what I'm supposed to do? Or it doesn't feel comfortable, but I'm going to do it. Well, everyone else is doing it. It must be okay. And so that's why it's so important to have leadership people in leadership positions that are held accountable. And it starts from the president on down. And we're never going to be perfect, but I just feel like when we can change, if we have responsible leadership up top, it starts to kind of trickle. That's the only trickle down thing that I ever believe in is I don't believe in economics. But leadership, and as Mamma Ruth always talks about, it starts with the parents, the mom. The mom teaches the kids values and so forth. Do they follow it all the time? No, but that is something that they look.
You know what? At the end of the day, if we see it in reality, at the end of the day, it's just us and our pillow. Yeah. So it's just you as a human being and yourself, and knowing, because once you're in that situation of getting sick and wondering as a leader, you know, as a mother, that I have to take care of my family, but just for me not following one small and just following my big leader saying, oh, we don't believe there's COVID.
Yep.
I got sick and now I'm suffering and my family will be suffering. Mm-hmm. So you have to learn how to separate between the leader and my family, myself. What am I gonna do to protect them, not my leader? Yep. So, you know, there's a lot of education that we need to still, even though it's been 9 months of COVID, we still are under the learning process. We don't know what's going to happen. I mean, I have 3 blocks away from here, Wesley Chapel School Elementary had to close for the next 2 weeks for 3 cases. If we would have prevented that at the beginning, we wouldn't have to go through it right now.
Well, I just want to say this for Thanksgiving. You know, if you do plan on having a Thanksgiving dinner, I do want to say they do, Mecklenburg County do give free COVID testing. So if you
Yes.
want to pop by and get your COVID test, because let me tell you, everybody got a test. They'll be like,
Yes.
if
See,
they
that's
start
another thing that we
talking,
were talking about, Joel, earlier, Kristen and I, where you have to show some type of symptom in order to get tested.
you do?
Yes.
I
Yes.
just thought you had, I was listening to WFAE today with the mayor, and she was just talking about the free COVID testing. So I didn't know you had to have symptoms.
The mobile units with Atrium and Novant, you have to have symptoms to get tested. They do have some that will allow you to get, like at CVS and whatever, you don't have to have symptoms. And that's very unfortunate. I agree with you, Joel. Everyone should be able to get, but I think that's kind of, I know we're going over just a little bit, but that's kind of what I was trying to talk to Steven, and I know it's a completely different show, woulda, coulda, shoulda. But if we'd had leadership that said, everyone wear masks, everyone try to get tested when we have those tests available right now, everyone try to protect each other so we can minimize the impact on our economy, we can get back to doing what you need to do, we can do this. But we didn't have that. We had, well, no one has to get tested, you don't have, what masks don't work. So there was a very, it was all just blah, blah, blah. And so hopefully we will have leadership now, if they'll ever do the transition, and even if they don't, and the longer we don't have that transition, the more it puts people at stake. And with Thanksgiving and so forth, I'm hoping that people, now that he has lost and people are starting to come to, even his own followers are realizing, okay, it's over, he's lost, that now that we will start to come back to, all right, now let's talk to each other, let's try to protect each other, because the quicker we can get safely through the holidays and wearing, the faster, the quicker. I want nothing better than to go to my sports bar and sit and watch a game. I want that so badly, but I can't because those fools won't wear masks. And I'm not going to put myself in a situation because I would expose other people to that. So we've gone over, I apologize. But I just want to say one more thing. Stephen, I understand your states' rights, and we need to have a show about this. One of the reasons that people who have been marginalized, like LGBT people, Black and brown people, aren't always for state rights, as you said, is because we've had states discriminate against us. So we've needed the federal government to come in to help us. There was a time where I could live in Texas and be fired for any reason, and I would not be able to marry the person I love, or whatever the case may be. But if I lived in DC, I felt safer, or in North Carolina. And so understandably that there are those of us who are skeptical about the states' rights argument, because we haven't always had states that protected us, and we've needed the federal government to protect us.
Yeah.
And so
That is a very valuable point. And I'll just say this specifically about marriage equality. The thing that gave the thing that gave Americans marriage equality wasn't the federal government. It was a majority of the states deciding that they wanted marriage equality in their own state. Once the majority of Americans and the majority of states had already granted their own people states' rights, that's when you got the landmark Supreme Court case, right? That just reaffirmed what the majority of states already had. So states' rights was actually the thing that gave people like you the ability to marry the person we want to marry, in this country. And remember, back in 2012, Barack Obama still was on the fence about marriage equality, right? And it's because politicians are going to politic, right? Regardless of what they truly believe or not. But once we had that critical mass of states that were like, you know what, we think marriage equality is something that we want. That's when you had it nationwide.
Yeah, Joel, real quickly, and then we
can
can close
right now, and let's just go to just churches in general, especially in the African American community. Barack Obama and Michelle Obama, a lot of Black people said that they would have never voted for Barack Obama if they would have known he would have been in support of gay marriage, because he called that gay couple on that airplane. This is from my own, out of hearing it from my own mouth. Thousands of Black people, kid you not. He took a lot of slack for that. Kid you not. It's just tremendous. You'd be surprised.
No, I hear you.
That is
I am
something not to
surprised.
play with. You just don't want to take stuff for granted
Well,
because
it's not that much different in our Latino community, our
Yeah.
Latinx community as well. So I just want to say that I think will and grace is the reason that we changed this country.
hopefully we embrace Dr. B's
There's
theology.
there's merit to that, Christian. Actually,
Oh,
when that was displayed like in public, it's like, oh, they're not weird. They're just like the people I saw on TV.
Yeah.
Like
Well,
cultures.
All right. We've gone over, and please stay on. We're going to go around, tell us where you're going to be, but just really quickly. I know we talked about this about a year and a half ago. We're coming up to our 2 years being. It's only been 2 years. Well, it's been 2 years. We've done this every week for 2 years, and that is coming up in just 2 weeks. And so we are gonna. I don't know what we're going to talk about, but it'll be something really exciting and fun. One of the things that we talked about when we first started this show, which shows you how we were, was who uses napkins at home and who uses paper towels. It tells a lot about you, whether you use a napkin or you just grab the paper towel. And I don't know if y'all remember, we did talk about, like, I'm a paper towel person, another half is a napkin person. Very different individuals. I can't believe you're using a paper towel at the dinner table. I'm like, well, why not? You know, it's, I don't know. I think it was a white thing, but I'm just saying that's just kind of.
What about linen napkins? What does it mean if you use linen
Oh,
napkins?
that's even worse. No, I mean, not worse, but it's different.
Oh, man. I'm going to lose my working class bona fides.
Yes. And so I want
Who
to.
even lives now in those kind of lifestyle?
Yeah, well,
Like using linen napkins. Come on. Setting up your table.
I got this yesterday. I'm very excited. I have not actually read a book in probably 20 years. I'm embarrassed to say.
And
yes.
That's the one you chose?
Yes.
I
I'm more of a newspaper.
I saw his interview yesterday about it, and it's very
audiobooks. Now I listen to audiobooks, and so I'm very excited to get that. I'm sure people are going to borrow it. Get your own book. And so now we're going to go around the Brady Bunch screen, and you tell us where you're going to be. Thank you so much. Next week, don't forget, we're going to get people together from all different points of view to see how we can come together after the election. Please join us. I hope that we can, be able to fist bump each other or somehow. On our Brady Bunch screen, we have Mamma Ruth, Steven, Dr. B, and Joel. And this was a great conversation. I'm sorry we went off a little bit on other things, but that's what we do. So
it's the nature of the beast.
That's the nature. All right, here we go.
I'll be here at home. I'm not planning to go anywhere. We were planning to go to the mountains, but we decided not to. So we'll be here. I'm still working out, doing my healthy choices. I'm changing my eating habits and trying to take care of my own body so that way COVID will not interfere again and make it worse.
Mama Ruth, the way you were sitting just a second ago looked like a mantilla or a tiara over your head with that clock back behind you.
Yeah.
That's cool. Yeah.
I'll be taking care of my second grandson. He's 2 years old, so he's a handful, and I love him to death, and I'm just experiencing that again that time. So, and I wish y'all happy Thanksgiving next week. I know we're gonna have another show next week, so we'll see each other. But please, community, please take care of your family. And by taking care of your family and your neighbors, it's taking care of yourself. So if you have to go to a gathering or whatever, protect yourself, keep the 3 B's, W's, I keep on saying B's, W's, keep your distance, wear your mask, wash your hands. It's not hard and you can do it. All right. And love y'all. Next.
Yeah. So I'm going to be working on some little projects for the LP. I got to get contact information for all the attorney generals and stuff like that, the election certificate officials for the 50 states, so that we can certify as a political party with the North Carolina Board of Elections.
If you see Jeff,
so that's going to be fun.
Ask him to give us a call or let us know if he's coming back ever again or not.
No, I want this position indefinitely. I'm not gonna.
We're not throwing you out, but we sure do miss him.
I'll reach out to Jeff, see what he's up to. He's been really busy. I talked to him the other day. I cannot wait for Thanksgiving. It is my favorite holiday. I enjoy hanging out and spending time with my family and stuffing myself to the gills. So I cannot wait until I'm like a beached whale on the couch with a belly full of, tryptophan, turkey, and just in that haze of just being a complete glutton. Super excited. I can't wait. It's gonna be fun.
Joel, you go next.
All right. Well, I will be taking, well, for one, I'll probably just be with my family for Thanksgiving. Not my entire, I do have a big family, but this year I'm only going to be spending it with 4 people. So that is, thank you, Dr. B. Thank you. I'm trying. We're trying, kid. We're trying. So that is how I'm going to be spending my Thanksgiving. You can find me working with, I just got back in touch with a woman at the Cabarrus Juvenile Detention Center. And so I'm trying to figure out what we can do as a city, as a community, to show love to some of the children that is behind bars, who didn't make the perfect choice or the right choices. But hopefully we can, show them that it's not too late. And there's, we're thinking about them, because that's something that was just on my heart. I went to the juvenile detention center, I think in 2019, and not a lot of people are talking about the juveniles. So that's something that we should talk about and mention and do something nice. So you probably can't get them a gift. You can probably get them a card. So I'll talk to you next week about it.
Joel, I think that's fantastic. I couldn't agree more with that point, that's, folks in these facilities are the most overlooked. And I think for so many of them, it obviously they had choices, but I think the system was stronger in putting them there than their own choices. So it's just a hard thing for everybody to kind of grasp. I'll be here at home. I'll be fixing Thanksgiving dinner for my wife and myself alone in our apartment while the rest of our family is off doing their thing. And keep wearing the mask and keep learning about systemic racism and what role I can play in helping it. There you go.
Well, thank you, everyone. We are actually one of the, one of the reasons we had this show, because we're actually going to Tampa. We're going to Tampa to visit my sister and a couple of, it's just 3 kids, and we're trying to do it as safely as we can, which is why I was trying to read up on the guidance. We took our test yesterday. We should have our results tomorrow, which hopefully it's negative, we can travel safely, staying in an RV. We're doing all of that kind of stuff. I do want to say that it is very important, and I think we just kind of reminded each other, hopefully today, it's very important that we understand how everyone's points of view is coming from. Because I agree with, I often think to myself, especially when we were during the election, who could vote for this person, or who would do this, or who would do that? And we have to understand that they're probably thinking the same thing with us, and so I do hope that next week's show that we can kind of understand where we're all coming from, so we can just have these conversations in a more peaceful manner. And that's really one of the exciting things about this new administration. I do hope that we go into an era of trying to have conversations. We're not all going to agree with each other, but at least we can respect where everyone else is coming from. I'm already excited. The Biden-Harris transition team, they have announced 4 Latinos or Latinx individuals in high leadership positions in their new administration. That is 4 more than the current administration already. I continue to think back at what Joel told us almost a month ago, that of the 150 federal judges that have been appointed, none of them look like me and him. And that was just I'm hoping that I'm excited about having people that look like all of us at the table of power, to the table of governments, because unless they understand where we are coming from, they may not make decisions that can help impact and move all of us forward. So with that said, we're going to end the show. If you're on this Zoom, stay on so we can do our promotion for the show. Thank you, Steven. It's always great. I'm trying to think about if Steven and Jeff were on here, Wow, it would be one exciting, and then Jenny.
And then you could see points of disagreement between Jeff and I, because
We need
it's
to
not a
invite Jenny in.
monolith idea.
We need Jenny. We need Tara on next week's show. We need Barbara. We need all our Kyle Kirby.
Kyle Kirby. We need the country Mexican to come back. The Trump
Yes.
guy.
What was that guy's name again?
Matthew. That's right. We
All
need
right, yeah. He was
we
funny.
need that lady from Pennsylvania. What's her name?
Yes, the lady from Pennsylvania.
Carol, or whatever her name is.
Maybe get Fernando back on,
Yes.
political consultant. And Joel, please come back, on next week, because we want to have, different perspectives and how to come back together. So, man, that would be exciting. And it would be wonderful to see how thankful we are to have each other in each other's lives. So with that said, we're going to wave goodbye. Thank you. And stay on if you're on Zoom.
Bye.
Give me 1 second. Let me make sure I don't disconnect you. All right.
Medicare for all, Dr. B. Yes. Medicare